Hi there! We're audiology students from Western University. Welcome to this visual lecture answering the question, why choose audiology? We hope to foster interprofessional collaboration between audiologists and doctors through this video. Audiologists are healthcare professionals who assess, treat, and educate to prevent hearing and balance problems. Audiology is a college-regulated health profession. We minimally require a master's degree in clinical science, volunteer work, and at least 350 hours of clinically supervised practice. We work in hospitals, private practices, long-term care facilities, and schools, with age groups from infants all the way to seniors. While many of us hold doctorates, we're not medical doctors. In fact, we depend on doctors for many things, including referrals to otolaryngology, diagnosis of hearing status, and diagnosis and treatment of middle ear infections, just to name a few. So, this got us thinking. Given the rising number of hearing-related issues today, what should you, the physician, be able to depend on audiologists for? For example, this is Mr. Smith. Mr. Smith has acquired a serious bacterial infection following an open wound injury. Given the case specifics, you as his GP prescribed gentamicin as an antibiotic, but you know the associated risk factors of this antibiotic include hearing loss and tinnitus. And this is Jackie, who comes in with her mother almost weekly with complaints of ear pain and possible ear infection. And then there's Tom, whose parents are concerned with his speech development and his behavior in school. Tom's been acting out and doesn't listen well to his friends and teachers, and now his parents are growing more and more concerned that they might have more than just delayed speech on their hands. And finally, Mrs. Lynn, an older patient of yours, offhandedly complains to you at one of her regular appointments that people mumble so much nowadays. How can an audiologist help you with this caseload? These are some of the many services that audiologists can provide. We do assessments that test the sensitivity of hearing, can assess middle ear function, inner and outer hair cell function in the cochlea, and auditory brainstem functioning, with both behavioral and objective testing measures. Many of us also provide cerumen management and provide hearing instruments and assistive listening device options for the spectrum of hearing losses and patient-specific needs, as well as providing many other important services. So let's take a look at Mr. Smith. In Mr. Smith's case, he should receive full diagnostic hearing assessment by an audiologist before taking the antibiotic to provide a baseline of his hearing. Then the audiologist can monitor his hearing with regular checkups, including otoacoustic emissions testing, which can detect hair cell damage before hearing thresholds are affected. In addition to testing, the audiologist can provide counseling for tinnitus management techniques if necessary. And let's have a look at Jackie. Jackie can be monitored through otoscopy, audiometry, and assessments of the middle ear function to help you document her progression. If needed, she can then be referred to otolaryngology for pressure equalization tubes. The audiologist can provide a baseline of hearing and monitor the conductive hearing loss to help ensure that speech development remains on course. The audiologist can also provide recommendations to Jackie's school about acoustic accommodations for the classroom. For Tom, an audiologist would conduct audiometry, otoacoustic emissions testing, and assessments of the middle ear muscle reflex. Auditory brainstem response testing may also be necessary to determine the possibility of auditory neuropathy in the absence of hearing loss. As a treatment, the audiologist can prescribe Tom with FM systems, assistive listening devices, and collaborate with speech-language pathologists to promote his speech development. Mrs. Lin is most likely experiencing presbycusis, hearing loss that occurs naturally with aging. We would provide full audiometric testing, including speech testing, oral rehabilitation, counseling, and fit her appropriately with a hearing aid and other assistive devices. Hearing loss is more common than one might think. It's the fastest growing and one of the most prevalent chronic conditions facing Canadians today, just behind arthritis and hypertension. Hearing loss is the primary sensory deficit among older adults. According to Statistics Canada, more than 1 million adults across Canada reported having a hearing-related disability in 2002, a number more than 50% greater than the number of people reporting vision-related problems. In 2012, this number tripled to more than 3 million Canadians. And those numbers are projected to increase significantly in the near future, with the baby boomer generation aging rapidly. The number of older adults aged 65 and over in Ontario alone is projected to be 4.1 million by 2036. That means about 1 in 4 people will have hearing loss at some point in their life. This also means that if there are 4 people sitting in your waiting room, 1 will have or develop hearing loss. Many people with hearing loss can still comprehend speech and communicate well in a quiet environment like the doctor's office. Hearing loss is an invisible condition. We cannot see hearing loss, only its effects. And most often, hearing loss happens slowly over time and can be difficult to detect. On average, it takes individuals with hearing loss 5 to 7 years to seek any treatment for their loss, because they might not realize or acknowledge they have a problem. They might also fear social stigma, may have misconceptions about the effectiveness of hearing aids, or may experience financial burdens that influence their willingness to seek help. There are a variety of medical issues that physicians routinely screen for in adults over 65 years of age. Yet, despite the number of those affected by hearing loss and the fact that most people do not readily seek help, it is not on the list of routine checks. In fact, only 14% of physicians routinely screen for hearing loss. Hearing loss has been linked in the literature to a number of other medical concerns. Family doctors are the greatest social influence to get people to seek help. So that makes you a patient's first line of defense in preventing hearing loss and its associated problems. Audiologists are here to help as part of your healthcare team. So, when Mr. Smith, Jackie, Tom, or Mrs. Lin walk into your office, our unique services are an essential component of your patient-centered care. So, why audiology? Because head-to-toe care for your patients includes their ears. And by ears, we mean the entire auditory system, from the pinna to the middle ear, the cochlea, and through the neural pathway to the brain. Thanks for listening.